Summer babes and gentlemen. We thought we would start doing a little series.
Yes.
Christy Cashman is my non-invasive body contouring expert who's such a wealth of knowledge and has been doing body contouring procedures for over a decade and has taught others on many of the techniques, including cryolipolysis. But we thought, I've got finally a free lunch.
Yes.
I try and squeeze in some things and like walk the walk and talk the talk that with what I'm, instructing patients on and talking to them about some of the benefits of the devices we have here at Art of Skin MD. So we thought today we would focus while I'm actually getting a treatment of EMSculpt Neo technology. Yes. And so we're actually, I think, one of the first to have this device here in San Diego and California. And it combines two different technologies. You can see it's toning my rectus abdominis muscles right now, and we can treat lots of different muscle groups. We'll talk about that. But I am doing this for a couple reasons. A, I'm 6'1", and I'm leaning over patients all day, all the time. So I've done an initial series on my buttocks and on my abdomen, which are really complementary muscle groups, and it's so much that gives us core strength.
Yes.
So I do it to get through my day functionally, but there's obviously some aesthetic benefits in addition. Functionally also, I love doing yoga. I'm pretty active outside of work, and I find that my core strength is so improved doing this, and that's demonstrated by the studies. We know in these studies, regardless of person's body type, regardless of their age, regardless of what area of the country that the studies were conducted, we lose within a series of treatments about 30% of the fat in the targeted area, and we gain 25% muscle mass. And that's super important because starting about in our 30s, every decade that we march through, we lose about 10% of our muscle mass. It's a process called sarcopenia, and when we lose too much of our muscle mass, it starts to affect our balance. So really exciting and interesting is they are going to start treating vets with this technology to help them with stability, and I think we're really going to see some huge quality of life improvements. So beyond the functional, which is amazing, there's also obviously aesthetic improvements. So we're in June, we're almost to the July 4th weekend.
Summer's here.
Yeah, and finally here in San Diego, the last week and a half we've gotten amazing weather, and so people are going to be out and about. It's starting to be swimsuit season, and if you want to enhance some of this muscle tone beyond some of the functional benefits, obviously we would like to look nice if we're in a bathing suit. So that's certainly like an added cherry on top of the functional sundae of why we're doing this. So maybe you could talk a little bit about like how many treatments we normally do.
So normally we would do a series of 4 treatments to any chosen area, and they're done a week apart. 30-minute treatments, no downtime. You can come in, get your little workout in, and then go back about your business, go back to work, or go run your errands, whatever you need to do with no problem. Sometimes I do extra treatments in a series, but for the most part, the average patient is 4 treatments. You see the benefit in the muscle almost immediately. You feel the benefit in the muscle almost immediately. And then for 2 months after your final treatment in the series, you will continue to improve. So the muscles continue to build and the fat continues to reduce. So after about 2 to 3 months later, you'll see your final optimal result.
Yeah, and there's a direct effect on the fat that's right underneath the surface of the skin. That's the fat that's in front of our muscle chamber that's holding in all of our internal organs. But beyond that, what's really cool is there is an indirect effect, and this is actually, there's been close to 24 studies really backing this technology, and I think when I select to bring devices into Art of Skin MD, I want to make sure that they're going to get results, that they're comfortable for patients. So you can see, I'm sitting here talking to you, it feels warm, and then my muscles are being stimulated. It's not a difficult treatment. But we want things that are evidence-based. I think that's one of my pet peeves with social media is people declaring things and not having studies to back them. And there is a wealth of knowledge, more so than I think most devices in the body contouring sort of space, showing the effectiveness of this. But what is very cool is there was a study that showed imaging before and 6 or 12 months after treatment, showing that visceral fat, which is the bad fat that encases our internal organs, was actually diminished, and that is objective. This is imaging data.
Yeah.
So I think that's really exciting, and that's not a direct effect of what we're doing right now. It's more an effect of we're building muscle, we're decreasing fat, we're helping metabolism.
Right.
So for those patients that, would come in and they have tummies that there's not a lot of pinchable fat, we could help maybe their muscle,
Right.
but also maybe now do something with visceral fat. I think that's really incredible. So we've seen some transformation stories where I think, us doing some simple things with patients that just have stubborn areas that want to get more muscle tone, really kickstart them into a more healthy lifestyle.
Oh my gosh, absolutely. Yeah.
So maybe, do you want to show some of the different applicators?
Yes.
We're treating the rectus abdominis muscles, so this is like, your 6-pack, your 8-pack. We also have an applicator that fits on the sides against our flanks, and it's called the Flex, and it sort of is able to do a couple of things. It's got an applicator on either side and sort of sandwiches, almost like a little V shape.
Yeah, just fits right around the waist here. So it hits these oblique muscles, and then it also has radio frequency that hits the flank or the love handles back here. So you get a little bit of fat reduction in the back, and then you get your muscle stimulation still to your obliques on your abdomen. That's kind of new.
Yeah, and we really like that because it's almost like corsetting.
Yes,
We
exactly.
can treat the rectus abdominis like what we're doing right now on my abs. And maybe you can kind of zero in so people can actually see the muscle sort of toning that's happening.
Yeah, exactly.
I'm like an ectomorph. It's really hard for me to get muscle mass. And this has been one of the things that I've actually been able to get muscle definition from. Because I'm able to super physiologically contract my muscles.
Yeah.
This is beyond what the best Olympic athlete and the best trainer in the world can do.
More than anybody could ever do on their own.
We're stimulating beyond what is physically possible on our own. So let's talk about some of the different applicators, because you were mentioning you just treated your quads, Christy, right?
I did just treat my quads. So I had lost some muscle mass in my quads and was noticing a little more crepey skin and just a little more junk down here. So I treated my quads actually with this applicator here. And
on either side, right?
Both sides, yes, exactly. And what I've noticed already, it's only been a month since my last treatment, and I've already noticed smoothing of the skin. I've noticed more muscle definition, and this little area here actually has picked up some. So I'm loving the treatment on the quads, and I've done several patients in that area too. It just helps with that kind of wavy skin look, because this with radio frequency, the heat also helps to stimulate collagen and elastin in your skin. So you're getting a little added bonus of a little skin improvement as well.
Yeah, and for most of our female patients, if we're doing abs, we use one paddle. For some of our male patients, because they've got greater muscle mass, their torso is built a little differently, we can actually put 2 paddles.
Yep.
So they get the benefit of like 1 paddle per section of the rectus abdominis muscles. But these paddles are also used if I was to flip over on the buttock region. We were actually the site for that study where we did an MRI study and demonstrated, again, 25% muscle mass gain in the all 3 muscle groups. So the minimus, medius, and maximus of the gluteal muscle group.
You get just a little lift in that booty. It's fabulous.
Yeah, so we do that a lot in combination with some of our collagen stimulators. If people are wanting sort of buttock rejuvenation and they want a little extra volume, a little better shape.
Yeah.
I would say most of our patients are, they're working out hard, they're living a good lifestyle, but they've noticed maybe what we call buttock ptosis, platopygia, which means a flat buttocks and a buttocks that's dropped. So this is one of the foundational things, building from deep, the muscle groups, then helping the fat compartment with sort of volumization if that's appropriate, and then helping skin quality too with some of the various injectables. And if you've got a little RF, we might see some added benefits too.
Well, the other thing that has been huge lately is people on the GLP-1s.
Yes.
So for weight loss and for rapid
And those
weight
are
loss.
things like Ozempic.
Yeah,
just
exactly.
So people are
And
familiar.
Wegovy and semaglutide, tirzepatide. So when you have rapid weight loss, you also have rapid muscle mass loss, basically. And this actually is a great way to maintain or prevent muscle loss. And also, if you've already sort of lost that muscle, to build it back up a little bit easier, because it's not easy to build back up.
Yeah.
So a lot of patients are coming in after losing quite a bit of weight and having this treatment to help
Tone and tighten a little bit.
tone and tighten a little bit.
So we talked about buttocks, we talked about abs, we talked about the quads. Tell me some of the other areas you're treating with
So
patients.
actually, I've been treating a lot of patients on the whole backside here. So the buttocks, and then under the buttocks, so the posterior thigh, you can do with this applicator as well. That helps with that little roll underneath, and it just kind of helps with the texture of the skin and just continue to lift everything in the right direction. Yep. And then the other area we can treat with this applicator is the outer thigh. So those little, hard to reach areas with
What
exercise.
we sometimes call saddlebags.
Exactly.
And we were actually the site for that study as well. So showing imaging improvements and reduction of fat in that area. Right. So that is an area that's just so hard to tone, and I think this is a technology, if that is a particular concern, you certainly can talk to Christy about.
Absolutely.
Tell me about arms.
So arms, this is our little arm applicator. So you basically stick this on here, you can use it there, or you can use it on your, biceps or triceps. And again, same thing for treatments. So you're getting a treatment to this area back here, which is just such a hard area for anybody to tone, especially women. And then also in the bicep area, so it can help just alleviate the look of some creepiness in this area, and just really help with, this is a hard area to get rid of any added or adipose tissue or fatty tissue in this area, so this can help reduce that as well by up to 30%. So
tell me about maintenance, because I tried to be a better girl. I did a series of treatments, and then we've kind of been doing a mini series. Yeah. So this is, I think, my third abdominal treatment. I've done a couple on the buttocks. Yep. Need to do another one this week to try and get bikini ready. It's getting harder and harder each year, but we're gonna fight the good fight. Yep. So the studies support up to a year without retreatment. We maintain this muscle. Nice. But I think we often talk to patients, because they're very motivated with the results they see, about doing like a quarterly treatment.
So what I've been telling patients is every 3 to 6 months. Yeah. Most patients love this treatment so much they do come in quarterly just to keep that result
and I
going.
love the benefit I physiologically feel. Like I started this again last week. I went to yoga on Saturday. It was a plank heavy class. Yes. We're doing lots of downward dogs and planking.
Exactly. I've noticed Pilates too.
Oh my gosh.
I'm so much stronger. I feel so much stronger after I do
it. Almost feels like cheating a little bit, but I'm going to take it.
Okay.
And then we do some cool things, tips and tricks. So you guys probably can't notice it, but I know when the pulse train is coming. This pulse train is so different from other devices. The company has developed the pattern of contracting the muscles that gets the most benefit out of each treatment. So there's times where I'm a little bit relaxed, and that's done on purpose. There's times when there's longer pulse trains, and that's really trying to get the most benefit and almost tetany out of the muscles, and then washing out the lactic acid. But I am actually kind of anticipating it, and this is something we help coach patients specifically on, to actually contract the muscle group, because I think we get a little added benefit out of that. But then there's also a cream, if we can grab the Body Transform. So there's a product from Alastin called Body Transform, and we were actually, along with a plastic surgeon, lovely Dr. Amir Muradi, we did a couple of the early studies looking at things like EMSculpt and things like pool sculpting to see how a topical can actually enhance the results. Absolutely. And so what has been found, this has the trihex technology, so it's got small peptides, small proteins that have been demonstrated in as soon as 3 weeks through histologic, so these are skin biopsies, to build collagen and build elastin. This is the structural and sort of component and elasticity of our skin, which we start to lose starting around 25 to 30 years of age. But what's most important, we're trying to lose fat in certain areas, so such as the abdomen. When we're doing any cool sculpting procedure where we're trying to reduce sort of resistant areas of fat, we've shown in studies through imaging objective data where we've sort of ghosted before and afters. Volumetrically, we calculated that, and you lose 30 to 50% more fat. This was blinded, like one side of the body was treated with the cream, one wasn't, in multiple patients. we lose more fat with the topical cream. So this has become standard of care. And this is actually what I use, and I mix it with a revision product called Body Firm.
Yep, I've been doing the same thing.
And I love
that.
it as my body moisturizer.
Yes.
So I continue to use it because you get the benefits of sort of stabilizing good fat, getting rid of the bad stuff, and building some collagen and elastin to help with the integrity of our skin as we mature through our lives. So we are going to start doing this a little more often.
Yes.
Do a little lunchtime
info
treatment. You guys can see,
Yeah.
you know, in real time what it's like as a patient. I am not the bravest one. I actually love this treatment.
Yeah.
It's,
No,
you know,
you're good.
I get to either
Yeah.
Netflix and chill or
Exactly.
get to chat with you guys. But I think we're going to feature some really cool tricks. There's a new cream we're using with Cool Sculpting that we've had some really nice results. Not just after, because we use the Body Transform, but something called CMT cream, which we've used to help with a little bit of spiciness after treatment. So we'll talk
Exactly.
about that in our sort of next little get together.
Yes.
But want to wish you guys a wonderful July 4th weekend.
Happy summer.
If you have any questions, we're actually doing a special.
Yeah, we're running a special this month that may extend a little bit, we'll see. But it's 15% off a series of 4. So any area that you choose, we do a 15% off the series.
Yeah, and
So
if you're doing a
give
series, talk
call.
to us about maintenance because we
Yes.
have, you know, I think
We're
high
gonna
interest in subscription plans and helping you sort of maintain physiologically, anatomically, and aesthetically your goals.
Right.
But hope you guys are having a great week. Have a wonderful holiday weekend, and everybody stay safe out there.